Hi everyone, my name is Justin Rush, and today I will be doing a brief summary on my manuscript, Understanding Athletic Trainers' Knowledge, Intervention, and Barriers Towards Arthrogenic Muscle Inhibition. Overall, the purpose of this study was to just get a better insight as to athletic trainers' knowledge and perceptions of arthrogenic muscle inhibition, or AMI, and seeing how they might be treating this condition, just to see if there's any sort of barriers or to see if there's anything that we can do to better support our clinicians for treating this condition, as we believe this is very common in patients with ACL reconstruction and ACL injury. So what we did was we sent out a web-based survey that just used different Likert scales to target athletic trainers that are administering rehabilitative services, where they were asked questions about their just generalized statements about arthrogenic muscle inhibition, what types of interventions they're using, and any particular barriers that they see with treating arthrogenic muscle inhibition. And so what we found was that athletic trainers typically had really good knowledge about arthrogenic muscle inhibition, and I believe it was 101 out of 143 athletic trainers that were included in this study. They had really good knowledge, and they're able to identify the correct definitions and correct statements about arthrogenic muscle inhibition. However, when we start to consider interventions and whether or not they're using interventions to treat arthrogenic muscle inhibition, we're seeing that only 58 of the 101 clinicians that knew what AMI was were actually using these disinhibitory interventions. And so even though that they were using the disinhibitory interventions, the timing of the use might not be appropriate for actually targeting arthrogenic muscle inhibition. So things like focal joint cooling, so using ice around the joint, only 36% used it before rehabilitation to facilitate the motor neuron pool in terms of treating arthrogenic muscle inhibition. So that kind of lends us to believe that we need to do a little bit more educating on how we can actually use these interventions to leverage the nervous system and improve muscle function. And then in terms of barriers, we found that overall difficulty quantifying AMI and also lack of education about AMI were the biggest barriers for treating arthrogenic muscle inhibition. But when we looked at the difference between those that use interventions versus those that do not use interventions, the perception of the barriers that are listed here were much greater in those that did not use the disinhibitory interventions. So again, I think this goes back to a lack of education kind of deal, where maybe we need to better educate our athletic trainers on how we can target arthrogenic muscle inhibition with the different types of interventions that we have, and that would be easier for us to tackle some of those other barriers as they become more educated on what we could do to treat arthrogenic muscle inhibition. So going forward, I think some future research should look into athletic training education programs and just seeing how they're training their students to treat AMI, but also thinking about how, when presented with information with arthrogenic muscle inhibition, how is clinical practice changing? So are they using these tips and tricks to kind of improve muscle function or use it in their rehabilitation? That would be really important for patients with ACL reconstruction. So going forward, I think those would be the next steps with this, and just better education on this condition altogether. But pretty much that is the summary of my research for this manuscript. So thank you for having me today, and I'm really excited to answer any questions that anybody might have. You can reach out to me on Twitter, or you can email me directly. Looking forward to having some discussion on this. Thank you.